Hello, my name is Zung Vo or Voswin Zung. I am a pediatrician in Vancouver, Canada. I specialize in adolescent medicine, and I'm very honored to be speaking to you today from Vancouver, Canada. I would like to share some slides. So today, I'd like to tell you about the Mindful Teen, the science of well-being in adolescence. As an adolescent medicine specialist, my passion and my profession is about helping adolescents be as healthy as they can be. And mindfulness is a big part of that for me and for the patients that I care for. I'd like to disclose some conflicts of interest and commercial interests. I have a book called The Mindful Teen, which has been translated in Vietnamese and is available in Vietnam, for which I do receive royalties for. And I'd like to share a little bit about how I started on my practice and journey of mindfulness. You'll recognize that this is Zen Master Thich Nhat Hanh Suong, or Thay. And this is me with him in 1999 with my father. This is at his practice center in Plum Village in France. And this was my first time being immersed in mindfulness. I did a 3-week long retreat, and that was one of the most important parts of my medical training, because at this retreat, I learned that mindfulness was not some idea, a philosophy, a theory, but mindfulness is a practice. It's a way of living, and it helped me so much through my young years in medical school, in residency, fellowship, in my medical training. Since then, I've learned to offer it to the teenagers that I care for as well, because if it helped me so much, I thought it could help them as well. But this is where I learned it from. And mindfulness in the West and in science has become really big in the last few years, really the last 10 or 15 years. But so much of it was influenced by Zen Master Thich Nhat Hanh. So I think we can say that Vietnam can be very proud that we have offered this gift to the entire world. One of the leaders in bringing mindfulness into the West was Jon Kabat-Zinn, who was very much inspired by Thich Nhat Hanh. And Dr. Jon Kabat-Zinn was at the University of Massachusetts, and he developed a program called Mindfulness-Based Stress Reduction, or MBSR. This has been studied with thousands of studies over many years, and it has really become extremely influential in the science of mindfulness for health and for well-being. Since then, other scientists and doctors and psychologists have adapted and used mindfulness and meditation, including Marsha Linehan, who developed a therapy called dialectical behavioral therapy, which is a very powerful psychological therapy for people with borderline personality disorder and emotional dysregulation. And Zindel Siegel, Mark Williams, and John Tisdale developed a program called Mindfulness-Based Cognitive Therapy, or MBCT, which has been very helpful for people with severe depression. And in the last 10 years or so, we've seen a lot of mindfulness in children and schools and in clinical settings. So I think this is really one of the next great frontiers of mindfulness in science and in healthcare. What exactly is mindfulness? I think it's something that cannot really be defined in words, but this definition is one that I have adopted from Dr. Kabat-Zinn. Mindfulness is paying attention in a particular way, on purpose, in the present moment, and with unconditional love. So paying attention, this is something that we often tell children to do. Pay attention to this, to my teacher, to the instructions, but we don't really teach them how to do it. Mindfulness is a way of teaching people how to pay attention and practicing it. It's a skill that we can grow and strengthen. It's on purpose. It's something that we are choosing to do. It's in the present, in the here and now. We're not being pulled away into our worries about the future or our regrets about the past. We are right here in the present moment. Even if we are planning for the future, even if we are preparing for the future, we are fully aware of the present moment. And with unconditional love, that means that we have to offer kindness and compassion to ourselves and to other people, even and especially in difficult moments. Paying attention is not enough. If we pay attention and the situation is painful, we're feeling discomfort, and we don't bring love to that, then that can actually make us feel worse. But when we pay attention and we combine it with love, that's when mindfulness can really be healing. Mindfulness in science has really exploded in the last several years. This graph shows the number of scientific articles that have been published on the field of mindfulness, and the horizontal bar is the years. So you can see in 1980s and then in 1990s, there were very, very few publications of mindfulness. In the early 2000s, they started to increase. And since 2010, there has been an explosion of mindfulness research in scientific journals. And the last year that we have data for, 2018, there were 842 publications in scientific journals. So the science has really been blowing up. And what we've seen from the science and from the research is that mindfulness can help people with stress management. It can help people with depression and with low mood, people with anxiety and anxiety disorders, worrying too much. It can help them focus and pay attention. It can help them have healthier relationships, and it can help them manage pain and illness. Most of this research has been done in adults. There is some research done in teenagers as well, but not as much. So far, the evidence and the science is very promising that mindfulness probably can help teenagers with attention deficit hyperactivity disorder, for example. It can help them with emotional regulation, manage stress, depression, anxiety. It can help them with social behaviors, having better pro-social school functioning. So in other words, getting along with their peers better, having less conflict at school and at home. It can help them sleep better. It can help them have healthier blood pressure. It can help reduce risky behaviors that sometimes teenagers get involved with, like fighting or substance use. And it can help them deal with chronic illness. As a pediatrician, those are the young people that I care for often, is that they have chronic illness, which is really impacting their health, and mindfulness is tremendously powerful for them. It can also help in school. CASEL is the Coalition of Academic, Social, and Emotional Learning. And CASEL believes that we need to bring more than just academic education into schools, but we also need to bring what's called social emotional learning into schools. And these are things that children and teenagers need to learn how to do in order to be really successful, healthy, and functioning adults. And they have 5 domains of social emotional learning: self-management, self-awareness, responsible decision-making, relationship skills, and social awareness. And mindfulness fits into every single one of these. Mindfulness helps with self-management. When people are more aware, they're able to manage their own emotions. Mindfulness is actually a practice of self-awareness, moment to moment, knowing what's happening right now. When people are more mindful, they're better able to make responsible decisions because they're able to regulate their emotions and tap into their values. They have healthier relationships because they can have better communication with compassion, with presence, and more social awareness. So mindfulness is not only individual. We're not only aware of what's happening inside of us, but we're aware of what's happening outside of us and around us as well. And mindfulness is a training for all of these. So the field of mindfulness and the field of social emotional learning have really come to overlap and merge. And in the West, in North America at least, social emotional learning is now becoming a major part of the education in many, many schools, thousands of schools across North America. And mindfulness is not the only strategy for social emotional learning, but it is one of the most beneficial and one of the best studied. So this is why that I think that what Happy Schools is doing is so impressive and so inspiring, because mindfulness can help students in Vietnam learn these competencies as well. And that can help them to be the most successful, both academically as well as socially and emotionally and professionally. So it is educating the whole child. As the ancient philosopher said, Aristotle, educating the mind without educating the heart is no education at all. And that's what mindfulness does. It aims to educate the heart. I'd like to tell you about a mindfulness-based intervention or therapy that I helped to develop in Canada. It's called MARS-A, Mindful Awareness and Resilience Skills for Adolescents. And we adapted different mindfulness-based interventions that had already been studied, like MBSR and MBCT. Myself and Dr. Jake Locke, who's a psychiatrist at BC Children's Hospital where I work, developed this. This is for adolescents age 15 to 19 who have depression or anxiety, often with other chronic illness or chronic pain. We made adaptations to MBSR and MBCT, and we developed a course that is 8 weeks long, once a week, 90 minutes each, and there's 1/2 day of mindfulness as well. And then since the COVID pandemic, we've adapted this to a virtual online platform as well. We've done some research studies on MARS-A, both at BC Children's Hospital as well as a few other centers in Canada. We've looked at quantitative data as well as qualitative. So quantitative, these are things that we can count and calculate and measure. Qualitative are things like interviews, reports of participants who describe their experience and the outcomes. And what we're finding is that MARS-A is very promising for helping adolescents who we serve help with their managing their pain, help them to function better and have less disability, and then help them with their psychological distress. And we've also found that it is quite feasible to do online, which is really wonderful because that means we're able to meet and reach many other people who cannot come to an in-person session. And I'll just show you one example of some of the data that we found in our study in Vancouver. We measured depression using an instrument called the CESDC, which is a very widely used scale to study depression. And what we found is that the scores went down from before they took the MARS-A course to after. It was statistically significant, which means that it was unlikely to be by chance. And it was also clinically significant with a significant effect size, which means that the magnitude or the amount of improvement was noticeable and would be important. I'd like to show you a short video of a youth who is sharing her experience with mindfulness. This is a young person named McKenna who went through our mindfulness program.
Hi, I'm McKenna. I've been a patient here at Children's Hospital since as long as I can remember. I've seen a whole bunch of different clinics here like orthopedic, rheumatology, plastic surgery, anxiety, and now the mindfulness clinic. And I realized that I've learned a whole bunch more than what I thought I would learn when I first joined. And I use these skills to like everything in my life now. It's totally changed my life.
Living in the past is living with depression. Living in the future is living with anxiety. Living in the moment is living mindfully. So this 8-week program that we have is to teach the youth the skills and the tools to live in the mindful moment in addressing their pain, their anxiety, and their depression.
I first joined the program as a way to help me manage my physical pain. And I didn't realize that I would come out of the program 8 weeks later learning so many new skills, and not only just how to cope with my pain, but just how to cope with a whole bunch of different aspects of my life. It's not what you would think. That's what I learned. I learned it's not so much meditating. You learn a whole bunch of different skills too, and you're just you learn to focus and be in that moment. Not so much about what you said or did in the past or something you're worried about in the future. You're just kind of experiencing things as they come in that moment, and it's a cool way to live. When you have pain, for example, you're kind of like, okay, I don't want this pain, go away, I don't need this pain. But sometimes it's kind of interesting to be like, okay, I know I have this pain, and I don't know how long it will be here, but it's here, so I should just, breathe with it, and it almost works. It almost seriously takes that pain away. And it reminds me of being a kid again, because when I was a little kid, just everything you do is in the moment and you're not really worried about anything else. So mindfulness has kind of brought me back to that, just being in the moment, which is cool. I know it helped me a lot, and I think it could benefit a lot of other patients as well, because we go through so many medical appointments and life can get pretty stressful. So it's nice to make sure you're taking care of yourself as well. I think I actually really would. I know that I've kind of learned all the concepts, but you know what? I don't think I have. I think that you will learn new things every single time you try it, because we learned that no moment is the same, and I might come into it with a totally different view, and I could learn so many new things. I just wanted to say thank you to the Center of Mindfulness here at BC Children's Hospital, because you've changed my life in a lot of different ways, and I know you could definitely change some more lives as well.
So I hope that you enjoyed hearing McKenna. I think she's a really inspiring young person. She was about 15 or 16 when this video was done. And the reason I showed this is because I think it's so important that when we are teaching adolescents mindfulness, we can learn from them, and they can also be our teachers. And so we're really learning together. And I learn as much from the adolescents I work with as I teach them. And it's really joyful to bring mindfulness to them. So I want to share some closing tips and ways of bringing mindfulness to young people from my own experience. I heard this quote from an Indigenous or First Nations elder in Canada. And he said, when someone is hurting, just your presence is medicine. And for me, this is all about mindfulness, even though he didn't use the word mindfulness. Just your presence is medicine. And when I'm working with a young person, I want to be as mindful as I can with them. So I have to be mindful. It's not always about teaching the young person mindfulness, but it's about being fully present with them. It's not about knowing always the right thing to say or the right thing to do. Sometimes those are important, but what's even more important is just being really there, because that's what teenagers will remember. They'll remember someone was really there for me. They might not remember what the adult said or did, but they'll remember that person was really there. They weren't distracted. They weren't thinking about anything else. They weren't judging me. They weren't telling me what to do. They were just there. Another thing that's really important for adults who want to teach mindfulness to children and teenagers is that they have to practice it themselves. Susan Kaiser Greenland is one of the leaders in bringing mindfulness to children. She wrote a book called The Mindful Child, which did very, very well in North America in English. And she said, learning mindfulness isn't like piano lessons where you can have someone else teach it to your children. You have to learn it yourself. And the reason for this is because mindfulness is not some piece of knowledge. It's not even a skill. It's actually a way of being present, a way of relating to the world, especially a way of relating to pain. One of the things about mindfulness is that we turn towards pain. So when we're experiencing pain, whether that's physical pain or whether it's emotional pain like anxiety or stress or depression, usually we want to turn away from it. We want to distract ourselves. We want to pretend that it's not there. But when we turn towards it, it can really be healing. But the only way we can teach someone to do that is if we have done it ourselves. Otherwise, we won't even know how to show them. The other thing is that with teenagers especially, they know when adults tell them to do things that the adults themselves are not doing. They can sense this. And so if we want to ask teenagers to do it, we have to show them and role model we are using these practices ourselves. That's how teenagers will be interested and inspired. But if they are told to do something and they know that the adults are not doing it, they're not going to be interested. So we need to practice it. We also need to practice in community. This is a photo from a conference at the Harvard School of Public Health around 2014. Jon Kabat-Zinn is in the white shirt. Zen Master Thich Nhat Hanh is on the left. And Jon Kabat-Zinn said, mindfulness is getting popular now. It's hitting the mainstream. People are hearing about it. It's on the cover of magazines. But what are we still missing in the mindfulness world in the West, in modern mindfulness? And Thich Nhat Hanh said, community, Sangha. We are missing this aspect of mindfulness as community. We need to practice mindfulness not only as individuals, but as a mindful school. Or where I work, we are practicing to develop and create a mindful hospital where we practice together, where we are present together. And that's where the true power of mindfulness comes, where we can be a mindful community, a mindful school, a mindful hospital, a mindful city, a mindful nation, a mindful world. So I would really encourage you all to practice mindfulness as a community. And I know that that's already happening with Happy Schools and with many other initiatives. I think this is one area where Vietnam will have an advantage compared to Canada and the United States, because there is already a sense of community. Whereas in places like Canada and the United States and Europe, we're much more individualistic in the culture. So I think having this community aspect is very important, and Vietnam is doing really well with that. And I'll just close with this thought from Zen Master Thich Nhat Hanh: happy teachers will change the world. When we practice mindfulness from the inside out, we can offer it to our children, to our students, to our teenagers. They can offer it to their families, to their friends, and we can change the entire world by starting with ourselves. So thank you so much. It was really wonderful to spend this time with you.